Hello, my dear internship nursing students. Welcome to your world of internship nursing training. My name is د.شيماء جمال, lecturer of community health nursing, faculty of nursing, بعنوان University. I will talk to you today about hospital waste management. I will talk about these items. Definition of the medical waste, types of medical waste, facts about medical waste, sources of healthcare waste, waste management, waste recycling, reasons of failures of the waste management, high-risk people and the dangers of exposure to the waste. What is the meaning of medical waste? Medical waste is any kind of waste that contains infectious material. This definition includes waste generated by healthcare facilities, like physicians' offices, hospitals, dental practices in dental clinics, laboratories, medical research facilities as we call it medical trials, and veterinary clinics. There are various names for medical waste as we see biomedical waste, clinical waste, biohazardous waste, regulated medical waste, infectious medical waste, healthcare waste. These all terms have the same definition I explained before. There are various types of medical waste. Number 1, sharps waste. As we see in the picture, these include used needles, syringes, disposable scalpels, and blades. 2. Infectious wastes. These are materials contaminated by water and body fluids, cultures, and stocks of infectious organisms, and patient wastes from isolation wards. 3. Pathological waste. These include tissue material of humans, organs, fluids, and animal carcass of died animals. As we see in the picture, a glove contaminated with blood, goose contaminated with blood, and on the right side picture shows piece of body tissue may result from eradication operations or biopsy taken for laboratory diagnosis. 4. Chemical waste. Containers contain materials like heavy metals in devices as mercury used in sphygmomanometer devices, solvents in laboratory reagents, and detergents. 5. Pharmaceutical waste. Waste materials that include unused, contaminated, expired drugs and vaccines resulting from pharmacy inventory. Number 6. Genotoxic waste. Hazardous, mutagenic, carcinogenic, and cytotoxic drugs in cancer treatment and metabolites. 7. Radioactive waste. Products including radioactive diagnostic materials as used in X-ray and therapeutic materials as radiology treatment in patients with cancer. Number 8. Non-hazardous waste. Materials that are not biological, not chemical, or not radioactive hazards, as we see in the picture, may include paper, cartons, empty containers. The previous types of medical waste have a universal color coding guide. It means that each type of the medical waste should be placed in a specific basket and a specific container. As in red basket should place anatomical as blood and organs waste. Orange basket should contain clinical infectious waste. Yellow basket should have clinical highly infectious waste. Blue basket should contain medicines and used drugs. Purple should contain cytotoxic or cytostatic products as chemotherapy medicines. Black basket should contain municipal waste as non-clinical or medical waste. White basket should have dental waste. We should know some facts about medical waste. About 5.9 million tons per year is a medical waste. 85% is non-hazardous waste. As we said, it is contain papers and empty containers. 16 billion injections per year. 2 million needles per day. It's 100,000 needle sticks per year, according to National Institution of Occupational Safety Hazards. Due to the current challenges that all the world is facing today due to the pandemic infection of COVID-19 virus, we should also know the essential facts about coronavirus medical waste. Same regulations as regular medical waste. Use the patient paper tissue not regulated. Expect and plan for more waste. Add more bins and waste baskets in more locations. Color code so you don't overload. Follow existing medical waste rules. Face masks and gowns aren't regulated. Label even non-medical waste bins. Make signage multilingual. Then, what is the major sources of healthcare waste? Healthcare waste resulting from hospitals, nursing homes and healthcare, mortuary centers as morgue of died people, laboratory centers, blood bank centers. After we know everything about the nature of the waste, definition, types, and facts, now we will talk in brief about waste management. What does the waste management mean? Waste management is the process of collecting, segregating, disposing, or recycling and monitoring of waste materials, which results from human activity and are inherent to civilization. These materials can be of solid, liquid, gaseous, or radioactive nature that can pose a threat to both the environment and those living in the environment. There are various names for medical waste, as we see biomedical waste, clinical waste, biohazardous waste, regulated medical waste, infectious medical waste, healthcare waste. These all terms have the same definition I explained before. What is the dangers of medical waste? Unless it is managed properly, medical waste can present several health hazards to healthcare employees, waste workers, and the general public. Discarded needles can expose us to needle sticks and possible infection if they are accidentally sent to recycling facilities or if containers break open in transit. Housekeepers and cleaning workers are also at risk when sharps poke their way out through plastic bags. Hazardous waste can expose us to microorganisms, radiation burns, poisoning, pollution, and other dangers. Finally, improperly treated waste sent to landfills can contaminate our drinking water and environment. Who is at risk? As we see, the risk arose starts from the sanitation workers, who are in close contact with the medical waste. If the waste management practice fails at this level, it will transmit to the second level as the medical and the paramedical staff become at risk. If not controlled, the patient and attenders become at risk. Finally, if control fails more, all public become at risk for exposure to the danger of medical waste. Now, why do waste management practices fail? Waste management practices fail and may face some limitation when there is lack of awareness of health hazards related to healthcare waste, lack of training on proper waste disposal practices, absence of available constructed waste disposal systems, a low priority level even after knowing the harmful effects of improper waste disposal, a lack of funds and resources towards constructing waste disposal systems, And finally, occupational risks to health care waste exist but have not been efficiently addressed. Thank you. I wish all the best of health and wellness to you.